Okay, so now we're going to run a mono test on this patient. With a mono test, you can either use finger stick blood, or you can take the specimen that you've drawn from your patient and draw blood out of there, and you'll put it onto your little test strip along with the buffer solution. So when you open these types of boxes, you can look and see the directions are right here. So we're gonna go ahead and run this on this gentleman, and we're gonna be using 2 drops of venipuncture blood. So you'll take the cap off, and you're gonna put your pipette down to the bottom. You wanna make sure that your specimen doesn't have any additives. So we'll draw that up, and the dropper, we're going to put the lid back on. Okay. Ideally, you would have a tube holder. So now we're going to place 2 drops. 1, 2, in here. And then since we're using 2 drops of venipuncture blood, then we're going to put 1 drop of the buffer solution in here. And then we'll give that some time to develop. So I'm going to give you another option that you could use, and that's going to be capillary tubes. So you'll see that the package also comes with these capillary tubes, and that's going to be shown in another video. So these will be your capillary tubes, and they're just simple glass tubes that you can use like after you do a finger stick on a patient, you just fill it up like a straw. So this test takes 5 minutes to develop. We know that since this gentleman is full of fake blood, that the test is going to come out negative, but just like with a pregnancy test or a strep test, as we've seen before, you'll see there's a control and a test. The control will always come up positive just to show you that the test is working. And then the T, the bottom one, that's going to show up to tell you there'll be a line if it's positive, there'll be no line if it's negative. So that's how you're going to do the mono test, okay?